Welcome back to Psychedelic Therapy Frontiers, the podcast devoted to exploring the frontiers of psychedelic medicine and what it takes to cultivate a healthy mind, body, and spirit. I'm Dr. Steve Thayer, and today I join my co-hosts, Dr. Reid Robison and Dr. Joe Flanders, in an important conversation with clinical psychologist, clinical trial researcher, and psychedelic therapist, Dr. Chantelle Thomas. Chantelle introduces herself in the episode, so I won't do that here. We brought her on the show to talk about the stuff that's hard to talk about in this space, what we're calling the shadow side of psychedelic therapy. We open up about how our own imperfections can harm our clients, the high bar of competence and self-awareness that we believe psychedelic therapists need to clear, the limitations and potential pitfalls of training in psychedelic therapy, the importance of good supervision and being open to feedback for psychedelic clinicians, the dangers of seeking psychedelic sessions in the unregulated underground, and of course, much, much more. This was a challenging episode for us, but we thought it was important to bring these challenges to the foreground. If you'd like to give us feedback about today's episode or ask us questions, you can email us at ptfpodcast@numinous.com. I hope you enjoy today's episode. Thank you to everybody for joining us for another episode of Psychedelic Therapy Frontiers. This is going to be a special episode. I mean, they're all special, but I'm really excited to be joined by our co-hosts, Dr. Reid Robison, Dr. Joe Flanders, and our special guest today, Dr. Chantelle Thomas. Before we ask Chantelle to introduce herselves, let me just sort of set the stage here. So, our podcast, Psychedelic Therapy Frontiers, is one where we talk about our excitement about this psychedelic renaissance, about the possibilities for healing that psychedelic medicine, psychedelic-assisted psychotherapy provides us opportunities for. But over the year and a half or so that we've been doing this podcast, we've received several emails and questions about what one might call the shadow side of this work, or the dark side of psychedelic work. Certainly we're excited. But some of those questions include things like, what happens if my psychedelic experience doesn't seem to have an upside? What if it feels traumatic or destabilizing? We've gotten questions from people who've received psychedelic work, have had psychedelic experiences in what's referred to as the underground, right? From self-described shamans and guides. And sometimes that goes really, really well. And I have a few clients who might describe themselves as underground psychedelic refugees, where they've been really harmed, maybe even taken advantage of. And so we thought it would be important to address this head on and directly on our platform. And I met Chantelle at the MAPS training retreat a few months ago, and we really connected and had a few conversations about this very topic. And so we thought it might be important to bring a voice like hers on to talk about this important topic. And I keep calling it important. I'm also really nervous. You might detect a little bit of quivering in my voice. This is hard stuff to talk about, but I think it's important to dive into the hard stuff. So, Chantelle, would you introduce yourself to our audience?
Absolutely. Yeah. Thank you again for inviting me to be part of this conversation. And I too am aware of my heart beating in my chest. I think I have a lot of, well, I should introduce myself. Let me pause there. So my name is Chantelle Thomas, and I'm a clinical psychologist, and I practice out of Madison, Wisconsin. At least that's where I live. I wear a number of different hats, and I've been doing clinical research in psychedelics for the last 10 years, starting with working with psilocybin, and then having the opportunity to be trained as an MDMA-assisted psychotherapist and being one of the 12 sites for the phase 3 study in the Midwest here. And so have had the opportunity to work quite extensively with MDMA in that setting. And then also was fortunate to be trained as a ketamine-assisted psychotherapist in 2019 with the Ketamine Training Center. And then I also, like, my other job is that I'm the executive clinical director of a program called Windrose Recovery, which is a substance abuse dual diagnosis treatment facility for residential care. We also have an outpatient IOP program. We have a detox, and then we also have a professionals program in Chicago. And then we also do outpatient ketamine-assisted psychotherapy, which we started integrating into our residential treatment programming a little over a year and a half ago. And then I'm fortunate to have some relationships with other organizations like Polaris and Fluence to do some partnering with them around teaching. So lots of work to do. And I too was feeling myself just holding maybe a lot of energy around this topic because, well, it feels a little edgy to be talking about, which is, it's interesting to me that I feel nervous about it because my happy place is usually the edges, and I really like to dive into the discussions that many people shy away from sometimes around the shadowy parts of existence and humanity, because I get a lot of relief in talking about those things because it feels like the transparency around that gives me a lot of relief. But I think some of the most difficult, like, soul questioning, in many ways what felt pretty heartbreaking for me times as a clinician have come through my work with psychedelic assisted therapy in circumstances where I was concerned that I harmed someone. So it has been a real tremendous journey into humility of recognizing the tremendous power and privilege you exert as a clinician or as a therapist or a guide in this space, and how to hold that honorably is something that I am always questioning where I land on that, because I feel like I really just was in the right time at the right place to come into this work. And I realized there's a very small number of people who've had the opportunities that I've had. And so I carry that with a real deep sense of responsibility to act in integrity because of that. And so recognizing those times where I have absolutely contributed to an experience that didn't align for someone else, I recognize how dangerous that can be and how harmful it can be, particularly if you can't name accountability around that as a provider, as a clinician.
Chantelle, it's really interesting hearing you talk like that, about your own fallibility in this context. Maybe you can unpack that a little bit. Like your intro is so compelling. It's like, oh, I do this and I do that. I have these amazing opportunities and, maps and all this kind of stuff. And it's like, well, if you're still fallible, if you're still, subject to these kinds of blind spots or whatever, like what the hell chance do the rest of us have who are, light years behind you? What's the deal there? Why the vulnerability?
Well, the first thing that came to mind, and I'm not sure I even fully understand the connection, but it's kind of the same question that I asked myself of whether or not I'm screwing up my kids as a therapist.
Yeah.
And the answer is
yes, by the way.
Yes. Yeah. I'm always screwing them up somehow. I'm missing things all the time. And I think the biggest, my own ego gets in the way, my own history, my own trauma gets in the way, my own desire, my fantasy about what's supposed to happen in the relationship with my children and the reality of it don't align. And I don't think it's that dissimilar in terms of the ways we as humans make predictions about what we think is supposed to happen in certain work. And I think, the beginning of wisdom is the knowledge of your own ignorance. And so, like, for me, it's like the longer I've done this work, the more aware I've become of how much potential there is for harm. So it's not the curve of experience doesn't equate with me feeling more and more secure necessarily. It makes me more and more aware of the vulnerabilities that are inherent to this work. And so, and I've had, people that I've worked with who have been my teachers around that, and not people who trained me, but people who I was intending to help, who, ideally, there comes a time and opportunity, if you're conducting yourself in these spaces in the way that feels right, where you are able to ask the question, how did I get it wrong with you? And I don't think we ask that question enough. And I think it's a moral imperative to ask that question when you're doing this work, because your privilege and power in these dynamics that always exist when a therapist and a client, or a provider and a client, is just amplified 10x once you enter into the equation of non-ordinary state consciousness, and the power differential gets just majorly ramped when someone is in an intentionally vulnerable state.
I think it was Lily Ross who does sexual violence research and was interviewed on those episodes, Power Tripping, about some of the incidents of sexual abuse in psychedelic therapy, who said that in this kind of work in psychedelic therapy, when you take a drug that alters the consciousness, you're entering into a boundary dissolving state, which I thought was a good way to put it. We talk about ego dissolving, but the boundary dissolving is just highlights the need for that right relationship and that rock solid informed consent and checks and balances and good ethical discussions around it all.
Yeah, it's an interesting way to think about it.
Isn't that the point of the psychedelic experience, is to dissolve boundaries, to break up rigid, psychic structures that aren't serving us anymore?
I mean, it depends how you define a boundary, right? It's like the most misunderstood term in all of psychological theory is, what is a boundary? So I think there is the concept of impasses in someone's internal experience, or stuck points, or maybe a certain kind of inherent lack of flexibility. An analogy I use a lot of the time when I'm working with people, and I should say I'm very biased to have worked with people primarily with psychedelics who also have trauma. So my lens in doing psychedelic work is really a trauma lens. And so what I think about it is, it's like someone wants to get somewhere and they have this wall in front of them, and it has these stones, and there's mortar that's very thick and hard in between the stones, and they're trying to get over around something. And in order for that window of opportunity to open, that wall has to fall apart. Like the mortar starts softening, the stones start falling. And that process of things like destabilizing in that way, at the time that it's happening, is for many people one of the most disorienting possible experiences of their life. And then you maybe potentially in that role are there to reassure them that what is happening is exactly what needs to happen in order for the next window to open, or the next opportunity to open. So I don't know if I would lean in comfortably to the idea of dissolving boundaries, because I think what we're talking about is what happens in the internal structure for someone, and then what happens in the co-created relationship between you and the person that you're helping, the relationship you have to that medicine, the relationship they have to that medicine, and the relationship you have to one another. It's like this very complex, almost helix of intricacies in terms of what does exist in the field. And I think it's a place where certain kind of boundaries actually get amplified, or the need for certain kind of boundaries get amplified, as the way that I think about it, but not always named.
Chantelle, I wonder if we can actually work with some examples here. I think that we want to obviously respect the privacy of people we've worked with and colleagues and whatnot. I am aware, though, at the same time that talking the abstract, we could lose people. We might not have the same reference points for what we're talking about. I don't know, Steve, you had a pretty interesting story from earlier. You told me earlier, maybe on the extreme end or the sort of more, overt kind of abuse of power. But yeah, maybe we can start with that and see where the more subtle issues arise.
Yeah. So I have several clients who have found psychedelic work in, like I referred to earlier, what's called the underground. So these are guides, self-described healers, shamans who work with psychedelic medicine and or ceremony. And I've had a few clients go to these people and be really, really harmed. Not harmed necessarily because these guides are being too cavalier, although some of them are, like not cautious enough, but sometimes deliberately manipulative and malicious. So I had one client who went to a person who was serving them cocktails of psychedelic medicines, MDMA, psilocybin, ketamine, 5-MeO DMT, sometimes all in the same night. Had one client who, I think over the course of 6 months, was served 5-MeO in the form of bufo over 100 times. And at one point he sort of came to with this guide straddling him and told me later that this person was trying to drive my client and his spouse apart and sort of insert themselves between them. And this person had some very complicated feelings for this guide because my client had also experienced a lot of growth and powerful experiences. And so there was a little bit of, he even described a little bit of Stockholm syndrome, So, I'm changing details here to protect anonymity and privacy, but it's not a one-off thing. I've heard this from several different people who've gone in very vulnerable with lots of high hopes and submitted themselves to this person, made themselves extremely vulnerable, and as Chantelle referred to, like in these non-ordinary states, and was harmed. And then there's really no recourse. Like there's no licensing board to report this person to. It's technically illegal activity, so they don't feel really confident going to any kind of authority. Right. And then they feel totally alone in it.
Yeah.
Even back when MAPS founder Rick Doblin wrote his PhD dissertation on MDMA, he said that the loving and trusting state that induced by MDMA can make patients, clients more vulnerable to sexual pressure. He acknowledged that. It's like we've been talking about, because of the state of consciousness, the power differential, and like you pointed out, Chantelle, it's like exists already in that we're aware of and have a lot of guidelines around in therapy itself, but in psychedelics it's amplified and harder to regulate, because sometimes when these people who say the perpetrators of abuse in therapy, even if they're a licensed clinician, if they lose their license, they may still keep practicing in the underground.
Yeah. Well, and there's so many parts of, and that's a great example, just like in the transition to the unboundaried kind of aspects of the underground work. There's an intentional moving away from something that's very systemically structured, that's kind of monitored or regulated, right? So like there's constant cues to move away from something being regulated, or kind of part of why I loved doing the psychedelic clinical research that I did is I love that it felt like a total hiatus from traditional therapy in many ways for many people, just by virtue of the structure itself. The fact that even that we had 90 minutes to 2 hours with someone for an integration or a preparation session, as opposed to 45 minutes or an hour, right? That we weren't doing this systematic tracking of symptoms. We weren't coding the visit, like all of these things that kind of like explain what you're doing in that space, like go away in many ways when you get into psychedelic spaces, and the focus becomes something very different. I think both focuses are intended to be about people getting better, but the way that manifests, talking with someone who's sitting on a couch in a room that feels more like someone's living room than an office, right? Like, I think there's all these little nuances that send these nonverbal messages or cues to people that this is not a normal space where that kind of structure exists. And I do think that opens up the window in different ways. And then on top of that, the thing that I come back to over and over again is maybe one of the things that I feel like might be my greatest strengths also becomes my most dangerous quality as a clinician, which is the ability to connect to clients. That it's actually in the deepest moments of connection that I potentially become the most dangerous as a clinician. And the reason being that I can easily lose track of what I'm missing when the resonance feels really deep for me. And those have been the circumstances, the few that come to mind have been where I felt like, wow, this is such a strong connection and I'm feeling so much resonance with this person. I really am tracking what I need to be tracking for them. And I didn't have the wherewithal or the foresight or the courage or whatever to stop and say, you know what, this is feeling like a really good connection to me, but I'm just curious, like what sorts of things do you feel like I'm missing as we're spending time together? Or what isn't landing for you in this? It's like, it's not asking when you can tell, it's asking when you can't tell or when it feels really resonant. So like that's probably been one of the most biggest aha moments, is that if you think about these relational networks for people who have relational trauma, like becoming open in the presence of what feels like a depth connection, that is where you have the potential to create the most harm because you're in the right networks to do so. And so, whereas like, let's say with someone who presents themselves as not very compelling or engaging or like connected, people self-protect in a different way. And they don't know how to do that in the presence of someone who seems like they're 100% with you. And then add, psychedelics or these compounds to the equation, which then further widen that network access. And then it makes so much sense why people are at risk in a different way in those environments.
That resonates so much. And I actually never heard it really articulated like that. But again, it brings me back to this question. It's like, how many years have you been working with MDMA, for example? Before you had that insight? What's the number?
Before I had that insight?
Yeah.
Like really got it? Probably 3 years.
3 years.
3 or 4 years.
Okay.
Mm-hmm. Yeah.
There's probably a number of medicine sessions each year.
Yeah.
And I guess, I'm just curious. It's like, how does one develop? I don't know if it's the insight or like the navigational skills to do that, and sort of what are the pitfalls if you don't?
Well, my navigational skills were almost 100% reliant on having amazing supervision.
Yeah.
I cannot speak highly enough for having the right kind of supervision. And I think, I was honored to be acknowledged by MAPS as someone who they wanted to train as a supervisor. And that happened a couple of years ago for me. And at the time when they said, well, we're interested in having you, get training to become a supervisor, I immediately was like, I'm not sure. I'm not sure if that's right. Are you sure? It's same when they asked me to help with training. Like, I don't know if I know enough to be able to do this, but, I think in the supervisory process, like as I started to work with different dyads and do more supervision, another like kind of thing clicked off in my head where I said to myself, like, oh, now I can't seek out supervision because I'm a supervisor. And it was like this embarrassing, like, duh moment for me, where I remember my supervisor is Bruce Poulter. And so it wasn't on the case that I was supervising that I felt like I needed help, but it was on my own therapy case. Like I was doing my own MDMA participant and I was struggling, and I knew I was like kind of just like not landing it. And I knew the case was really activating for lots of different reasons. And yet I felt like almost ashamed or embarrassed that I didn't know what to do, like just intuitively. And because here I am supervising other people, and how could I possibly be in that position if I didn't immediately know, quote unquote, the answer, which again, it's a good exercise in humility to admit this in this space, because when I finally was like, oh, you mean I can still get supervision? I remember Bruce laughing, like very compassionately. But he was like, yeah. And he was always so good at saying, I seek out my own supervision still. Like this idea that somehow because you're a seasoned clinician and that you've been doing it for 10 years, 15 years, 20 years, and then all of a sudden that obviates the need for consultation or supervision is a really broken model, in my opinion, for not allowing therapists to really talk about all the times they get it wrong, or all the times where they feel completely out of their depth, or all the times that they recognize they're getting way too triggered by the person that they're working with. And I think it's probably why, again, many people get harmed in therapeutic relationships, because there's not enough built-in and integrated safety to have those conversations without, again, the fear of looking like a fraud, or this imposter syndrome, or feeling inadequate, or feeling like you've revealed that you're not capable. And so for me, it's not, it has everything to do with developing the acumen, the courage to be able to say, like, I'm never going to see this all. And so I need a circle, I need a tribe within my own community that I can lean on to bounce ideas off, and then formal consultation supervision at the same time, in order to do this work safely, to be quite honest.
Yeah, I beware of the ascended master, ascended master inside of us and outside of us. And I think your comment about supervision and community and accountability is really important. And it's often what's missing in this underground world of people who really don't have a community of practitioners to hold them accountable or give them feedback when their ego gets inflated a bit, or they get a little too confident, or the medicine makes them more confident than they ought to be. But I spent much of my young life questing for gurus, questing for people that I could trust would always get it right, because I didn't trust myself. And it was unnerving when I discovered that no such human exists. But also, after I sort of dealt with that terrifying realization, comforting, because now I didn't have to become the perfected ascended master in order to be helpful. And I can continue to grow and be helpful in an imperfect way. And as you stated, Chantelle, one way to protect other people from my imperfections is to continue to be open to the possibility of their existence, and get feedback and counsel and supervision and help from others, so that I can, preferably and hopefully do no harm and do as much good as possible.
Yeah, and I mean, it's somewhat philosophical, like, mission of the treatment center that we have, is because I saw this happen all the time in substance abuse treatment, where it was like a client had been struggling with some sort of cycle of use. And in the residential environment, when they spoke up about what didn't feel right to them, or something they felt they were needing that they weren't getting, or there was a complaint or a concern, I saw the weaponization of their diagnosis as like, this is just a part of your sickness. Like, this is you as an quote unquote addict, not surrendering, not capitulating, being willful, being ego driven because you're saying something doesn't resonate or doesn't feel right. And I felt like that was so incredibly exploitive. And at the same time, I see the parallels that can exist within that, where people get amplified to these statuses within psychedelic spaces, where they are regarded as these, frontiersmen or women who kind of allow the magic and the kind of non-ordinary ephemera of psychedelia to kind of like be trapped around them as part of their ethos. And so then this idea of questioning or saying like, well, can you tell me about when you've got it wrong? Or hearing them not publicly speak about this, in forums or in trainings for that matter. I think there's tremendous danger in that. And I think there becomes this really vulnerable window for, being even more empowered to be the voice of beyond, because you're wielding a medicine that is thought to be in connection with the divine or spirit or whatever lies beyond us. And so I can easily see how, in the same way, people don't want to fail their journey. They don't want to fail the medicine. They don't want to miss their opportunity for transformation. And so there's just like so much vulnerability in those moments where you are willing to risk it, to enter into these, like, I can't tell you anything about what this is going to be like, but trust me, I'll be the one that lets you know what you should be doing in these spaces.
Yeah, so it seems like we're touching on another kind of harm or another way things could go wrong. And I was going to ask, like, we've talked about sexual boundary violations and, what are some of those ways, or how would you categorize them? And then as a follow-up to that, I'm wondering, like, what are the other ways of accountability besides supervision that we might think about as a field?
So apologize, I missed the first part of your statement or your question. Do you mind repeating it?
Yeah. So how might things go wrong in psychedelic therapy in terms of this ethics discussion? We've talked about sexual boundary violations, and the one you just mentioned seems like it has a lack of informed consent potential, like that power differential being playing into where either the facilitator or the client not being able to be honest about the experience or what it might be like.
That we could do an entire week-long series on informed consent, right? Like, I think that is the most uncracked like area of psychedelic work, is like what really is informed consent, and what is, especially when you're preparing someone for an experience that 100% is unpredictable. I came into the appreciation of the concept of what you're consenting to is uncertainty. Like, as I worked more and more with MDMA, I realized that 90% of what I'm trying to do prepare people for the understanding of is that there is a lot of uncertainty that you're consenting to in this process. And yet there's still ways to create structure within that. I think part of why consent is so important is that I think probably the biggest vulnerability area sometimes in psychedelic spaces is that really isn't a proper preparation process. And so you're not, because there's a lot of fascination with the drug experience or the medicine or the compound experience. The preparation really does feel peripheral, I think, in many circumstances. And in more vigilant environments, there's a tension to ruling out certain things, but really getting a felt sense or an understanding of how someone is anticipating the experience internally, what sort of expectations they've hinged upon them, what pressures are they placing upon themselves to be a certain way in the context of that medicine experience, and how capable is this person of asking for help or speaking up when they feel like they're being wronged. Like, those are pieces of like a living assessment of informed consent that I think are very different than going through paperwork, right? About the things that could go wrong. It's this like living assessment of someone's capacity to speak up when they feel like something is misaligned. And then, if you don't build that into the infrastructure of the way that you prepare people, and it's not kind of built into the dialogue in a living way, it just gets kind of discarded as a box that's checked. And so I felt the very real pressure of, my own excitement about getting to dosing, right? And wanting to, especially again, when the connection is great, or if you're in outpatient land with ketamine, there's a limited amount of resources. And I literally worked with a client last week who said, God, this is a lot of preparation. Like, this feels like really like, can we just get on with it? And there was a part of me that thought, of course, like my anxiety part was like, oh, they don't feel like their time is being well spent. Maybe they feel like financially this is not worth it. Now, all these things got built into that one phrase that I then had to like very intentionally unpack with them on the dosing day, because I wanted to really understand what that meant, because I understood it kind of housed something really important about the relationship and also about the expectancy of what was going to happen. But I don't know how much support people are getting in knowing how to have those conversations and how to really spend their time in a way that feels intentional, but not like overly gratuitous and at the expense of someone's financial circumstances or their limitations. I think it's also the major risk of doing higher dose work out the gate is that you're not testing what someone's system is capable of doing in the moment when they enter into a non-ordinary state place. I have been inherently geared towards lower dose work as an entry point, because I feel like what I'm watching in that moment is how likely are they to ask for help when they need it? How likely are they able to talk about something that doesn't feel right for them? How willing are they to allow you to adjust things for their benefit? And you'll find that so many people will not even tell you they're freezing for the first 3 hours because they don't want to inconvenience you. Like, that is mind blowing in terms of thinking about their capacity to actually speak up when emotionally they're feeling harmed or something is in conflict or something doesn't line up for them. If they can't literally describe a body temperature regulation that is fixed by a blanket, like, let's really consider what people have been trained to do in terms of talking about what they actually need in these spaces and having the courage or the invitation to do so without fear of offending you as a facilitator, or without their trepidation, understandably based on their own history, about entering into some sort of relational conflict.
Yeah, those are really, really excellent points. And it reminds me of a dosing session that I was in not too long ago in one of our psychedelic studies. I'll leave it vague just to not name the particular study, but a classic psychedelic with different dose options. And the client we were sitting with, I was with my co-facilitator. At the peak of the experience, even though we had all these prep sessions and a good, solid relationship in place, they became scared of the facilitators. They became scared of us. Like, they thought in this peak of a psychedelic experience at presumably a significant dose, had some disorientation around that trusting relationship. And that's a whole another interesting issue. So I like what you said about low doses and testing the waters and testing one's ability to ask for help and testing the trust in really manageable ways, so you build up the marbles in the trust jar systematically.
Yeah, and so many people's especially if you're dealing, again, like in the relational trauma space, like, people have been trained to like sublimate what's needed. And so it makes so much sense that just like saying, hey, we're here for you, whatever you need, like, we're in the service of you, like, those all feel like really nice phrases they're being said by a person, but like the lived experience of safety within that request is not inherently not built in for people with relational trauma. So you can say it all you want, but for many people, if you don't give them the practiced experience of testing that out, including saying, hey, I really disliked your playlist, whatever it is, like giving people permission to be able to share those things without fear of consequences in terms of the relationship itself.
Yeah, and I did see this as well play out, your example around not wanting to disappoint the facilitator. That happened recently in a dosing session as well, with kind of an older individual who in many ways I'd count, a mentor or thought leader in their own right, in this vulnerable state, had this like kind of surprising to them feeling of not wanting to let us down as facilitators and wanting to do it right. Yeah.
Yes. Yeah. That's really big. And also this like, for me, when I enter into psychedelic space, it gets really complex because I have a lot of religious trauma and I have a very complicated history with God as it was described to me as a child. And to me, psychedelics felt like the closest proxy to that spiritual pipeline in many ways. And so for me, like failing a medicine journey or feeling like I didn't show up in the way that I wanted to felt almost like some sort of divine failing on my part. Like I missed my chance to align myself with this spiritual connectivity that might have come through this experience because of my own fear or because I was too controlling or because I couldn't let go enough, right? Like, and just think about the heaps of self-judgment and shame that get kind of launched onto someone's persona when they carry that history and they believe in the ethos of this work, but their system is just not ready for that kind of surrender, and nor should it be asked to in many ways. When there's not really a stable platform upon which they can kind of grasp, what are we asking people to do based on their history? Based on fill in the blank. I mean, it's a really interesting question or conversation, which is part of why, like, I totally have so much respect for trust, let go, be open. That was the phrase that was taught to me through a certain group that I was trained with. And then I thought, God, that's a pretty big ask. That is a pretty bold ask of someone who may have been exploited or abused by people who were telling them in many ways exactly the same thing in their history.
Chantelle, this makes me think about how much responsibility the facilitator or the therapist or the guide or the sitter has when someone is vulnerable like this, and how, I think we touched on this a bit earlier, talking about the relational networks and stuff. These psychedelic experiences can, transference is obviously a very big thing that we work with. I know it comes up a lot in the MAPS work. But it does put the facilitator in a very delicate position, a position of like enormous influence, where their own intentions and their own blind spots become like front and center. And of course, opportunities for influence, both good and bad. I wonder how you think about, how a facilitator ought to be managing that heavy weight that they take on in these environments.
Yeah. Well, I don't know that I have a perfect answer. Well, obviously I don't have a perfect answer. Ridiculous thing to say. I'm not sure I have a fully formulated answer to this, but what the first thing that comes to mind, albeit a major barrier to the economic multiplier effect of doing this work, is this idea about co-therapy. And certainly we've heard of instances where it goes wrong and sideways, most directly. However, I do feel there is, because of the weight of that charge, that I feel like I never understood what energy work was until I did psychedelic work. Like I remember people would talk about energy work and I'm embarrassed to say that I would roll my eyes a little bit and be like, okay, sounds good. And then I started doing, even the thing that really drove it home for me was actually doing ketamine sessions, where I literally felt things in my body with such amplification that I would walk out of a session feeling like I was in a non-ordinary state, and recognizing I couldn't do them back to back because I actually essentially was not oriented enough to enter into someone else's journey after having a really intense CAP journey. And I've definitely felt it with MDMA work too, maybe a little less so with psilocybin, because the way I was working with psilocybin wasn't as relational as those other two models that I've been using. But yeah, this piece of having a witness and then having a counterpoint to be able to kind of like, well, what did you notice in there? And even just to be able to like look across the bed where you're doing the session, or look across to make eye contact with someone else who is hopefully grounded enough to be able to track, feels like a really important safety piece around working with someone where the charge is really high. And I think the other, for me, the other largest piece of working towards establishing more safety around that is transparency and processing that in real time, not in the session itself as much as during the preparation, as soon as you start to notice it. So being able to have a process-based dialogue with people about what is this relationship feeling like to you, and what are you noticing about what I might bring up for you? I think that kind of process-based conversation, we think all the time about like, well, how do you prepare to become a psychedelic therapist? Like, there are fundamentals within being a therapist in general that are not inherent to every therapist practice, that kind of go outside just skills-based work or technique-based work, that has to do about process-based dialogue about the relational elements that I think are an absolute necessity in these spaces, at least as I understand them and as I navigate them. Because if you can't have that conversation in preparation, you're certainly not going to be able to have it in dosing when things get really charged, to lean into, I'm having this feeling, or I'm sensing that, and just naming it explicitly, I think is a really important element of being able to speak to what is not named, but what is felt. And I think what is not named, but is felt, gets even more amplified in psychedelic spaces if it's going well, to be quite honest. Like, that's kind of the point, as I see it, is moving off of these more content dialogue-based spaces into like process-based, felt sense, emotionally charged, relational, content, essentially. So I know I started that conversation and went all over in my response. I don't know if that lands for what you were speaking to, Joe.
100%. But again, I keep coming back to like, okay, it's not, super skill based. It's very like, it's energetics. It's this sort of relational field that's not always explicit. It's like, okay, MAPS trainer, how do you train people to do that? And what has your experience been like in trainings?
Well, I'm super curious to like poll Steve on this, because he went through a training with me. Like, both of you, Joe, you both went through trainings, MDMA trainings. Like, what did you walk away with learning about that? Like, I'm curious, like, what was your takeaway specific to MDMA assisted therapy?
Yeah, I had the distinguished privilege of having Chantelle as my small group leader at the MAPS training retreat, the MDMA training retreat. And I remember telling you, and I think Marcella Odalora, that the bar seems ridiculously high for psychedelic therapists. And bless her heart, Marcella was like, it is a high bar, and you've cleared it, Steve. Don't worry about it. I was like, okay, I've received,
I could hear her saying that. Oh,
a blessing. But yeah, I think, and I felt it was high for all the reasons we've talked about today, but this one in particular, that there are a lot, you can't necessarily just deploy a set of techniques that you read in a manual and feel totally comfortable that you're going to be helpful and not harmful. And I feel like from a training perspective, the way the retreat was designed with small group processing discussions and role plays was really helpful to sort of get in the trenches and see what that was like. And the role plays were not necessary. I mean, they were about using this particular approach that MAPS uses in their studies, but it was more about tuning into the energy, the feeling, the problem behind the statements of the client, and just trying to be with them in that space. So that's, I guess, a little vague, but it was both exciting and intimidating to kind of come to the realization that that is what is required to do this work. And I think it's something that is at least one part intuitive in a person and another part teachable and trainable. But sometimes I wonder, it's like not everybody is funny. Like you can't necessarily teach someone to be super hilarious. They can practice jokes and things like that, but some funny comes naturally to people. Timing and irony and all that stuff comes naturally to some people. And I think following the energy of another person's emotional state is, at least in some ways, also sort of this intuitive thing that we're born with. I don't want to discourage people listening. That you can't possibly improve and learn these things. I think you can, but yeah, there's something really fundamental about it that I think is difficult to teach.
What's interesting to me is that in MDMA-assisted psychotherapy and many other psychedelic therapies, there's this non-directive approach to the facilitation of sessions. But yet, as a facilitator, you need to be directive when safety is at hand or when you're preparing. Like you need to be very explicit about the appropriate use of touch, before each session, for example. So it's you really do need skills in both of those areas, I think, to navigate this well and be able to speak up when things don't feel right, or check in with your supervisor, or call out things that don't seem to be going well.
Chantelle, I can come back to your question if you're still interested.
I am.
I remember very, and by the way, for the record, Chantelle was also my home group
leader.
It's
true. Yeah.
So does that, I guess that makes Steve and I brothers in a way. I had a very, very distinct feeling of something along the lines of like, oh, I see what they're trying to get at here. They're like pointing to something that I'm not actually learning, but they're pointing to something that I need to learn. And this is how I should be thinking about it. And there's all these like really courageous and intelligent and well-designed attempts to get me to see something, experience something, feel something that was going to prepare me for MDMA-assisted therapy, but that I was not actually learning. So it felt like they were all sort of signposts to something that I needed to learn.
Yeah.
And then, I thought like that was really interesting, but like, I still don't, I've worked, I have a kind of experiential approach in my traditional therapy. So I had a bit of a reference for it. I have experience with non-ordinary states. So I was trying to triangulate. Obviously a huge piece that was missing, I did it during COVID and it was virtual, was actually getting, sitting with someone or having someone sit with me while I took MDMA and just having that real experience. So that was huge. And then, I'm in a position now to say that not only have I gone through the training, but I was a co-therapist in an MDMA trial, very, very difficult. And it sort of confirmed my sense of like, oh, I didn't really get it at the time. And like, wow, there's a lot to learn here. And, one of the things, this is an example, is like the co-therapy thing. I think there was a module dedicated to it, I believe. There was a lot of discussion and stuff, but it's like, oh my God, it's like I have me and all my shtick, and I have this other person with all their shtick, and it's like, sort of kept under wraps and in check and regulated, but sometimes it isn't, especially when you throw in these compounds and stuff, and it's like, holy smokes, this is really complicated. And I'm feeling like it's like how I'm doing what, the fight I got into with my wife last night is suddenly here in this MDMA session. Like, what the hell?
Yeah. Totally.
And so that, I didn't feel especially well prepared for, and I think I probably made a bunch of mistakes as a consequence of that. And and the supervision is really important, right? That it should be supportive and non-judgmental and trauma sensitive and all these things. And so, yeah, it's a really tricky thing to train.
It is. It is a really tricky thing to train. And I think, we've gone through so many iterations of understanding what training should look like, right? Like, and, in many ways, what I always come back to, like really resting into, is the supervision process.
Yeah.
Is like, because again, you can go through all this training and then you have, experiences are as diverse as the diversity that exists within humankind.
Yeah.
So you can learn the model on a particular type of person with a particular kind of trauma, and then you work with another person and it's like, it doesn't even feel like the same therapy. And that's like, a little bit mind blowing in many ways. It's, I remember when I first started learning how to do ketamine, went to I had already been trained as an MDMA assisted psychotherapist. I'd already been doing MDMA work. I learned ketamine in like a 5-day workshop. And I came out of there, now this is my bias, feeling completely underprepared to do that work, because I didn't feel like I really understood the compound. Like I didn't fully, I thought it was a thorough training in many ways, but it felt like wholly inadequate for what I felt like I really needed. And again, disclaimer on kind of how my process works and probably wanting to be over prepared. I was one of those people with tests that was probably obnoxious to other people. So, but that is part of it, right? Like your own psychology, like what do you need to get your head wrapped around something? Like what do you know about how you learn new things? Like how do you understand how you engage with the existing training platform? Is it a good fit for how you integrate information? Is it completely disparate from what you need? And so like this ability to self, kind of like, for many people, the luxury of being able to ask the question, do I actually feel prepared enough to do this? And like, if I don't, what do I do? And for me, it was like, I sought out consultation with people who'd been doing it, because I immediately knew as much as I'd been doing psychedelic clinical research for 6 years at that point, and I still felt like, I don't think I'm prepared to work with this compound yet. So I, sought out a dear friend in Colorado, Craig Salerno, who had been doing it I connected with him at the training, and I really respected him and I liked the way he thought about it. And I just talked to him, and I called Marcela, and I talked to Marcela because I knew she had a ketamine practice. So like I sought out people I really trusted, and I just asked all the questions that maybe I was embarrassed to ask in a forum, in a training forum, right? Because you're still impression managing in a training forum. You're still like trying to figure out how you fit within it. Like all of the psychology of, am I smart enough or good enough? Should I even be in this space, is in the room every time you learn a new thing. So I really feel that in many ways, the goal is certainly not perfection, right? In many ways, the misses in this work are the deepest insights. The danger is when you have clinicians that don't ask the questions that bring forward the disconnects or the ruptures. And for whatever reason, understandably, don't have kind of the internal fortitude to be able to tolerate getting it wrong, and without blaming the person that's sharing that information with you. And that, I think, in regular therapeutic practices, I have worked with a minutia of clients that have come to me and said, my therapist checked in with me and said, how's this therapy working for you? And, people don't ask that question. They don't go, do you feel like I'm meeting your needs? People do. I don't want to say they don't, but a large percentage of people haven't really been supported in having a dialogue about missing things, because again, it's easy to think like, oh, if you're a really great therapist, you miss less. And that's not necessarily the case. You just ask more questions to be able to suss out what's actually happening for someone, so that you become aware of those areas of disconnect or misalignment. And then the opportunity becomes like, how do we navigate it in the face of that feedback? And how do I become potentially corrective experience for you, where everyone else who you maybe have said this to was totally abusive and reactive and shaming and belittling. So it's, for me, the key piece here is not about attempting to be a perfect therapist. Like that is not the goal. It's really about the awareness that you will always miss something. The question is how big is the miss? And is a miss that's really big, how dangerous can it be for someone?
The scary thing to me, and what really was destabilizing to me when I was acting as a co-therapist, is, okay, I get it. I don't have to be a perfect therapist, but like, holy shit, I have to be a perfect human. It's like, I have to be super willing to like admit when I'm wrong. I have to be like totally not, not experience any shame or anger. And like, I know I'm exaggerating a little bit here, but it's like, like you have to be like a fully developed human, an adult even, so the years of therapy that I was acting as a therapist were sort of good training, but it's actually all this, talking about fighting with my wife all the time, but like the fights I have with my wife, the challenges I have with my kids, how I deal with my friends, how I deal with my colleagues, like all that stuff suddenly became on the menu. And I was like, what? Is this what I really signed up for?
Yes. Yeah. I mean, I think you're totally right. I mean, that's been my experience of it, is it becomes an exegesis on all your unfinished business. Like it really does. I mean, that's the amplification of the work as I see it. And that's the part that, how do I become a psychedelic therapist? And it's like, well, that's an interesting way to think about it, is like, how much of your personal work have you done? How do you do in the face of conflict? How do you do when you feel directly shamed by another human being? How do you do when someone points out where you got things wrong? Like those things to me feel like a really inherent piece of being able to kind of like earn the privilege of being in this enhanced position of power in those spaces.
Chantelle, this is, I could see it now. MAPS Training Institute, the tagline under the logo, exegesis of all of your unfinished business. That's,
I love that.
That's great.
And I want to clarify too, like I'm not speaking to this as a representative of MAPS, right? Like this is my personal take on what it's been for me within my own history and kind of like what that journey has been. And what I found to be really encouraging about it is a lot of the fundamentals that I learned in those spaces translated into every psychedelic space where I was working with people, and then became kind of like this became my own code of conduct, which continues to be a massive growth edge for me. But I was talking with my husband last night, who is also Steve got a chance to meet him. He's a neuroscientist and clinical researcher, and also his lab does a tremendous amount of psychedelic research at UW. And he also was trained as an MDMA assisted psychotherapist. And I said, I'm feeling a little bit nervous about going on this podcast, but I have a lot of confidence in the gentlemen that are doing it, because they're all really good guys. And I feel very supported in that. But I do feel nervous in talking about kind of the shadowier edges of doing the work. And he said, we'll just pull out the whole MAPS code of ethics, and every single item on there is because there's a shadow connected to the need to state the item on the code of ethics.
That's so true. And, in many settings outside of MAPS, we've like in ayahuasca retreats in the jungle where I've gone with a bunch of therapists, we've used that code of ethics and made sure it was not only read, but understood and discussed at length. And it highlights the need for those, and not just as a token document, but one to really demonstrate understanding and even competence in, like this, like the example you gave of being able to admit when you're wrong or take feedback would be so crucial to assess and have as one of those core competencies in therapists and facilitators that's widely accepted by a large pool of experts.
Yeah, and believe me, that continues to be my toughest growth edge, because I am like notoriously terrible at receiving feedback. Mm-hmm. Like I came from a family where perfection was an expectation. It was like, how did you do on the test? It was like, did you get the highest grade? I got second highest grade, who got the first, right? So like it is built in me to not want to get things wrong. Like it is a deep part of my psychology to feel incredibly shameful for missing things. And so, you know, like from like a cosmic writing, it feels so like, I don't think it was an accident that I was drawn to these spaces, because I felt like it finally, you know, I can talk a pretty good talk. And as you can hear on this podcast, much to my own, a little bit of my own horror, is I talk for very long periods of time, and I can talk about lots of different things, and I can be pretty articulate at times, but like that does not allow me very often to be kind of held into a certain kind of accountability around different kinds of things that I struggle with. And, you know, I'm in a position of power in my organization where I supervise a lot of people. There's not a lot of checks and balances on me as a clinician in that space. And a very important part of the relief and also the tremendous challenge that I experienced in working in clinical trial spaces where there's supervision built in was this opportunity to be able to talk about these areas where I really need to keep growing.
Yeah, I love that. On a semi-related note, I'm wondering what you think of the dyad model in terms of helping keep everyone safe in this work, and how it relates to work beyond the MAP studies and, you know, the other clinical trials where it's built in, but even in the ketamine work. I know we probably have different approaches in our group, but I come from a place of, you know, after I think 11 or 12 years of ketamine work and, you know, thousands of sessions, I've just always taken the approach of, you know, with a female client, it's never me alone. But I know that, and that's not a wrong or right thing. It's just been an approach. And I know there are other benefits to the potential to the dyad model, but wondering how you view it in light of safety.
Yeah, I mean, I certainly think, again, there's this inherent tension point about how do we make this available to more people and more people who need it and people with less resources. So immediately I'm struck with the very strong reality of how costly it is to have a dyad for folks. And at the same time, you know, I formatively learned about doing this work, not only in a dyad, but also being videoed. And so in many ways, I think perhaps in circumstances where people can't have a dyad, it's worth exploring the opportunity of videoing sessions in some ways. Like there is something incredibly important for my psychology about like imagining someone watching what I was doing in the session. Like that's how I like internalized it, was like, in case I get caught up in some like emotional current or just like what feels like this mountaintop moment, and the client is crying and I'm crying and it's like everything is charged, to just be like, if someone else was watching this, how would I explain what I'm doing in this moment? Like, how could I translate that and not just say, well, you had to be there, you know, you had to be in the moment, right? Like, I do think there is something that a person does when they're being observed. And I think in many ways that can be really challenging because some people may not like the feeling of it and they don't feel it's as natural. But for my personal journey, I think there's something really valuable about the possibility of deepening accountability with having a dyad or having another person in the room or having someone bear witness. But, you know, I'd be curious to hear what you all think about it and what your experience has been. Because I've also done solo sessions before, ketamine sessions where it's solo, and there's just different logistic challenges in being a solo practitioner in psychedelic spaces. And this is a really important part that we're trying to figure out in terms of what feels right for people.
I've generally really enjoyed the dyad model. Sometimes I like it because it doesn't have to feel like it's all on me. So if there are moments when I have doubts about how to be helpful or what to do, it's nice to know that I have somebody else that I can lean on. The flip side of that is sometimes I get a little annoyed with my therapy partner if they're doing something that I think is, I don't know, lame or not the way I would take it. This isn't the direction that I would take. This isn't. And so it's a great opportunity for me to be thoughtful about, why am I reacting that way? Is this my pride? Is this, do I need to be in control of this? What even is control in a situation like this? I remember experiencing this as a Mormon missionary, where you're paired up with another person and you kind of can't leave their side for 2 years. And just having
thoughts. Is that part of it?
Yeah.
That's so interesting. Yeah. Okay. Sorry. I get so excited when I hear you talk about your history.
Yeah. And you don't get to pick who you're partnered with. And sometimes you're with them for several weeks, sometimes several months. And really the only time you're not with each other is when you're in the bathroom. And so sometimes it's great if you really click with somebody, and sometimes it was torture for me.
Yeah.
And we're teaching and ministering to people, and I've got a direction I want to take it, and my missionary companion's taking it a different direction. And I remember one time I was in my early 20s, and he's teaching a lesson, and I just rolled my eyes apparently. And I wasn't aware of how hard I rolled my eyes. And he looked over me in the middle of the lesson. He's like, is it okay with you if I keep doing what I'm doing? And I was like, yes, of course. He's like, of course. It doesn't look like it.
No.
So that was an important lesson for young Steve on being careful about the messages you send. And I've thought about that often as working in psychedelic therapy work in a therapy dyad. I also need to be thoughtful about how I am being in the room energetically and implicitly and explicitly for the benefit of the client. I want to be able to give these clients all the confidence in the world that we can hold them safely through this experience. Because, we're talking about a lot of the challenges right now. And I'm imagining, somebody listening to this podcast being like, holy crap, I'm never going to get psychedelic assisted therapy. If these people are so imperfect, how can I possibly have a good outcome? I've just been really thoughtful about our own imperfections and, what would give a client confidence in the work that we do.
Yeah. I love that.
It's a great conversation killer.
No, I was thinking another reason I actually really like dyads is because it's really good for my history, because, share another not so flattering story about myself, but I remember as a kid in class, the physiological sensation that would come over me when someone would ask a question that I knew the answer to and I didn't get called on. It was I could literally feel it starting at my feet and rising up. And the longer it took for someone to call on me when I knew the answer and wanted to show that I knew the answer. And what was this amazing, and I practiced growing into adulthood, purposely not raising my hand when I thought I knew something, because I knew there was some edge there I needed to understand or do something with. And I also didn't want to be that obnoxious person in class. And what happened is I noticed when I started doing co-therapy, the same sensation came back when I wanted to say something in a session and my co-therapist would talk first, or I was ready to say something and I wanted to create enough space for them. And so the other real gift of the co-therapy model is it behaviorally, environmentally reinforces the idea that you don't have the answer. You yourself don't have the answer, and that there's this tremendous value to decentralizing you as the person that holds the information or even the questions for that matter. And I think it's that shifting across multiple people in that way. And ultimately, if you're doing it well, the client walks out feeling like they're the ones that hold the answer, right? Not you. But I do think there is this other piece for me about the dyadic work, that the same thing that it makes it challenging is the thing I trust the most about it, which is it kind of exposes all of my therapeutic reflexes and forces me to be more intentional about what I'm doing in the space with someone.
Yeah, that's really well said. That point has never been driven home more to me than in a dyad experience where, my co-therapist speaks first, they say something that I wouldn't have said, and I'm sort of sitting here like, oh well, we'll see where this goes. And then it goes really, really well.
Really well. Yeah.
And I'm like, oh, I'm such an ass. Such a wonderful teaching moment.
Yes. Or just like the ability to sit with the pause, right? Like thinking you know what you want to say and just waiting longer before you say it. That the gift of that. I mean, I think people who are like uber meditators will be like, duh, because they've been doing that for a long time.
Right.
Or really mindfulness based people, like that's a big part of what we're teaching people, is to widen the space for the pause, right? But man, that has been a real gift to me, and it's continues to be a massive growth edge. And when I'm overly tired, not well slept, cranky, irritable, whatever, I just create, my therapeutic style becomes so much less spacious, and I just fill up more space immediately.
Yeah, I mean, a testament to the other type of work that we need to do to meet this high bar of being clinicians is taking good care of our nervous system, taking good care of our bodies so that we can, to the extent that it's possible, be at our best when we're showing up for people in these vulnerable states. Because when I'm cranky or tired, I talk more, I'm more directive, there is less of that space. I'm less patient.
Yes. Yeah. And using like little skills like diaphragmatic breathing. I mean, I'm a biofeedback practitioner, and that was literally the way that I got myself through those moments where I was like, but I want to say something, like that, especially when I was working with someone who's newer or is still learning the model, like really learning how to get in self-regulation inside my own window of tolerance to be able to kind of like, and it's also the other inherent like beauty of that outside of the whole like dyadic complexity is it's really a way to, in a very experiential, felt sense way, reinforce the idea that the wisdom is not in you and it's in the client or the participant. So like all the time I'd have this like, ooh, I want to point this out. And I would just go, wait. And then like, 20 minutes later, boom, it comes from them, or something comes from them that I totally would have shifted off course if I felt the need to like share my wisdom in that moment.
Yeah, that's one of the things I like about the inner directed approach and this concept of an inner healer or an inner healing intelligence. It helps take the pressure off. Kind of like I said, with having another therapist in the room can help take the pressure off. Like, not only do I not need to have all the answers and steer the ship, I would be doing this person a disservice if I tried. If I tried to give them all the answers, or I tried to steer the ship.
Yeah, there's just like something incredibly powerful about demonstrating your trust of their process through your silence. Like that's the most powerful mechanism of reinforcing your trust in their process. I mean, that one thing that I also feel like really compelled to just like underscore is, again, Bruce Poulter's been like an incredibly important person in my life and a very important mentor for me. But like I had a lot of shame around how I navigated like liftoff in psychedelic spaces in the times when I had opportunities to do medicine work. I had I had this impression that if you couldn't just like absolutely surrender yourself to whatever was happening in the moment, and just like with this total this total surrender, if you will, that it was really a personal failing of mine. And I went through a massive a silent but massive crisis internally around whether or not I belonged in this space as a facilitator, because I wasn't on board for, like, I wasn't like all in with ego dissolving processes. Like, I found them to be, in many ways, feel really traumatic for me based on my own personal history. Again, I mentioned the spiritual trauma, but this idea of surrendering to something that I can't see, that I don't fully understand. Like, we were conditioned as kids to be, told that that was kind of how the devil worked. So, like, when someone was like, you're going to enter this process and let go and trust it, but you're going to feel totally out of control and it's going to feel like you're moving into darkness, it was like every single part of my system was just struck with terror. And I almost came to the conclusion that I don't have any business being in this space because of that. And then I'm quite certain it was Bruce and actually Marcela at the time. I was talking with both of them at the end of, I think it was the ketamine retreat. And they both said, it doesn't have to be that way. Like, you can develop a relationship with a compound, very slowly, based at the pace of what your system can actually handle, what you can tolerate. This idea of bigger, faster launches into more abstract territory where you lose all, these transformative doses being the only way, not only the only way, but that there wasn't a whole lot of value in hanging out in those other spaces. That paradigm shift, profoundly impacted kind of my mission, which is essentially, how do we create a bridge for people who are not psychonauts? How do we create a bridge for people who need relief, who need a little more support, but are every part of their system codes that as absolute fear and terror, and loss of agency becomes a really reinforcing thing around their own trauma history. So how can we use these compounds to kind of to meet people where they are, as opposed to training them how to let everything go in order to be available to the compound experience? And I think that's really important. I don't think a lot of people talk about it. I think it's the biggest risk of doing psychedelic medicines in group spaces where you don't know the people really well, or the people who are facilitating. And there becomes this comparative experience where people talk about, I remember literally being in a training setting and just having a absolute struggle and just feeling really awful. And, a third of the room was talking about dancing with Jesus in the clouds. And I was like, what has happened? I did not have that experience, right? And what do I do about it? Especially when you have someone facilitating that environment who is just a diehard, just proponent and a believer in all the good things about that medicine. And they don't really put a spotlight on talking about challenging experiences, or it doesn't work well for what's being pitched at that training moment. So, I've personally experienced really difficult integration around processes like that, because I didn't know how to make sense of why my experience felt so disparate or discordant, or why I felt so raw and vulnerable, and everybody's just switching right back into training gear. And I thought, I need 2 days of integration right now. So just to really take a lot more care with oneself when you're entering into these spaces where, really well-renowned, very well-respected people with really great pedigrees, it doesn't mean that they know how to really prepare you for this journey per se. And that you can call it training, but it's about personal work. And the moment you take that medicine, it stops being training. So this idea that somehow it's going to stay in a really contained envelope around that, or that what comes from it is safe enough to be processed in a group environment. I mean, these are presumptions of those spaces that not all spaces, but some of them, that based on your own unique history may not work for you. And if anything, may feel really not great for your system. And if, may make you ask really big, tough questions about whether or not you belong there. And I would just say that people need to take a lot of care in what they know about themselves. And, maybe you go with someone you're really well allied with, who can be a really safe support to you in those environments, because, the presumption that it just will be there because, you're all like-minded people is just not true for a lot of people. It is for some, but not for everyone.
Chantelle, I see that we've been on here quite a while. I wonder how everyone's energy is.
Yeah.
My energy's good. I can keep going, but I wanted to check in with you. And I wonder too, like, I feel like, the last part of your answer there was orienting a little bit towards some like recommendations, right?
Mm-hmm. Yeah.
And we've identified a lot of, risks and a lot of dynamics that are challenging and this kind of thing. I wonder if we could put our heads together here and come up with some, whether it's just kind of educational stuff for people that might be looking around for a psychedelic therapist or guide in the underground, right? Where they might not really even know where to start in choosing someone, or even, for practitioners that are, a little freaked out right now. Some resources for them about maybe how to navigate some of these challenges.
Yeah. So, I mean, I guess the first thing I'll say, and I'm not sure I want to be as practical as possible, but it's more of just like a thing to hold in mind in terms of like the discernment of how you navigate, people who are representing themselves as expert in these spaces is, someone's pedigree doesn't mean anything about their safety for you. I can't emphasize that enough. And just to hold that in mind, and that's not to be disparaging about people who have impressive pedigrees. It's more about like for your unique history based on what you need in terms of availability. I cannot emphasize enough is if your gut is telling you something feels off when you're engaging with a practitioner, listen to it over every other message that comes to you around their work, regardless of how many people they've helped or how well regarded they are or how long they've been practicing for. Your greatest safety net is your gut in these spaces and your sense of I feel fearful. Or one fun question I like to ask myself is how well do you think this person would receive critical feedback from you? And if you think in your head, like there is absolutely zero space for me to say anything critical or even any space for me to say anything at all, then I would strongly advise you to take a pause, in that endeavor. If you have any concerns about your ability to safely navigate, these big experiences. So for some people that works, but not for me.
I really wish someone had told me that a couple of years ago. That would have saved me so much grief. I'm not going to get into details, but I'll just amplify that a little bit by saying that I think one of the challenges here, like speaking for myself, I was so, and still am, so enthusiastic and so keen to have experiences as a therapist. It's like, oh, that'll be fine. I'll figure that out when I get there. And it's just like, wow, no.
Yes.
That listening to the gut is really good advice. And unfortunately it can sound generic. I don't think it necessarily does in this context, but it's really is advisable to wrestle with that phrase and what it means to you in these contexts. So yeah, I really dig that with you on that.
Yeah. And this other piece is that like not all medicines are right for all people too. I mean, that's the other thing I can't emphasize enough is to like really do a little bit more research around different types of compounds and like what the launch rate of different medicines are and how that informs how high people dose different medicines. Again, certainly not recommending anyone having experiences that are not appropriately sanctioned or monitored, but knowing that people will seek things out to really take into deep consideration what you're asking of your system to allow it to be part of this experience. And based on your history, how do you think that will work based on what you know about your experiences where you lose all control or potentially how do you do in groups or, it's okay to ask like more rigorous questions about the environmental factors that promote a sense of easedness and safety and security for you. Like, I feel like sometimes because of that enthusiasm and because of the potential and because it feels like, a journey or an experience, that people just stop becoming discerning about their unique habitus and how that might align with this experience, because there's so much value placed on the idea of something that could transform you.
Yeah.
And so I do think there is like tremendous value in really taking careful consideration around that. And this will be the last thing I say, I'd love to hear from you, is like, really, if you do happen to get in dialogue with someone, really asking them more questions about, like, tell me what it's like when it has gone wrong for people that you've worked with. Mm-hmm. I would love to know what a difficult or challenging experiences look like and how you handled it. And what have you learned about people who struggled more in doing this work with you or struggled more in group environments? Like, to be a little bit more curious about seeing if someone can really speak about a more nuanced perspective on when it goes really well and when it doesn't, because those cases absolutely exist. It's whether or not someone is willing to talk about them becomes a very different part of the conversation in terms of being informed about what you're doing.
Yeah, I'm thinking a lot about this point around the experiential aspect of psychedelic therapy training, putting us in vulnerable spaces, and maybe not assuming that based on a person's pedigree or the reputation of an organization that they're going to be holding safe space or providing opportunities for processing, and rigorously researching sort of what the agenda is for the training retreat. But also, I would encourage people to not stop with one training, not stop with one organization or one guru. Get a diversity of training. Get a diversity of supervision to the extent that you can. Reach out to as many people as you can find and as will respond to you, whose message you respect or at least are curious about, and get a lot of different perspectives. And I feel like that's one way to protect from the thing that I've always been afraid of, and that's just being sort of seduced by somebody who's smart, charismatic, and seems like they have all the answers, is to make sure you have a diversity of experiences and opinions, and a diversity of people with strong opinions too. And if you can find anywhere on YouTube or anywhere else where these people are debating each other, that's even better.
Yeah, good point. Good point.
Oh, I love all these recommendations, and I think we've covered some golden ones. I don't have a whole lot to add other than reiterating the need for, besides good training, good ongoing supervision and good guidelines, like guidelines for how to navigate these tricky areas. Like I'm thinking about Oregon psilocybin facilitation that just rolled out this month, and they have a stance on dual relationships, and something about not entering in any relationship for a year after, and not with the client, and not seeing people you supervise or students or romantic partners or even like family members for that regard, and how to navigate those things, and even more important, how do you resolve ethical issues? Like, where does one submit a complaint, and where is it discussed and investigated? Is there a whistleblower policy for people to speak out in a safe way? Yeah, I think where the field is at its infancy in this reemergence, the time now is just so crucial to have these discussions and proactively keep having them and keep iterating on these recommendations in a good way.
Chantelle, I have one that I need your help in unpacking. Okay, I learned at the MAPS training, like I heard this phrase a number of times, like, understand your intentions for entering this field. I was like, I understand my intentions. I want to do this. This is so cool. It's so awesome. It's like psychedelics. It's awesome. And I don't know if it's like the best analogy I can come up with is like a karma thing, where somehow the universe like is somehow your deeper intentions manifest in psychedelic environments. And so, I was aware of some of my intentions. And, maybe it was about sort of the press release I had about why I was making this career change that I didn't literally have a press release, but just like what I was saying to people and what I was saying to myself. But, what ended up manifesting for me was like, oh man. So like when I was little and I felt unseen in a certain way that really sort of shaped my development and my, experience in relationships, that deep intention is now showing up in this psychedelic therapy. So that's sort of what I learned through experience. But like, how would you articulate this thing around know your intentions?
Well, I mean, I think you kind of beautifully, I'm not sure what you need my help with, because I think you beautifully described it. I mean, I think it falls along the lines of what we spoke about before. It's like, it gets thrown around quite a bit, I think, in therapist circles. It's like, not so secret, and yet people don't explicitly talk about the fact that they became therapists because they're trying to heal themselves. Like that's like a thing that gets said, but like then people don't live the reality of that by actually holding themselves into deeper accountability around how that shows up in their therapeutic relationships. And so there is no question that like my desire to feel like really special and subversive at the same time has drawn me into psychedelic spaces.
Yeah.
Like I love the idea of juxtapositions. I love the idea that I was helping people do psilocybin in the School of Pharmacy at the University of Wisconsin. Like I love these mashups that just feel irreverent yet right. I love the idea of disrupting things. I love juxtapositions. I also think anything that brings the shadow forward is probably a really good thing for our culture. And then the flip side of that is that it brought forward my own shadow of slowing down, like recognizing when I am not in the know, popping the bubble on my like great instincts and intuition as really dangerous reflexes. The list goes on. And I will say that the privilege, it'll make me emotional. Like the deep amount of privilege and heart that is available in spaces where people are healing themselves in front of you. Like it should be really uncomfortable to earn that position, to be able to have the honor of watching someone do what they would never be able to do otherwise, in front of you. Like you should be uncomfortable to get there. You shouldn't just be able to sign up for it. That's my take on it. Because it is like, it's such precious, rare air to watch that happen. So that's a plug for the gift of it. They're not separate from one another. They're directly connected. The hard work, the self-scrutiny, the self-reflection, and the absolute joyful privilege of witnessing someone heal. I feel like two different sides of the same coin.
It's beautiful. Give me the chills.
Likewise.
Well, Chantelle, it is such an honor to have you join us for this conversation, and I'm so brace yourself because I'm going to praise you quite a bit.
God, I'm getting a bad connection.
I'm losing you. I'm just so impressed and thankful for your integrity, like your willingness to come on this show and to have a hard conversation, to be so vulnerable, to be an example of strength in vulnerability. It just means a lot to me. It's so wonderful and comforting to see somebody with expertise just sort of flay themselves in front of people and
That's my thing.
like, yeah, I'm smart. I've got a lot of skills. I put myself through the ringer so I can have the honor of doing important work. And sometimes I don't know what the hell I'm doing. And that's okay, because I think to some extent we are all in that space. And so thank you for being one of my teachers and one of my friends, and for joining us in this important conversation about ethics and the shadow side of this work. And yeah, thank you so much.
Well, I want to credit back to all of you creating sufficient safety for me to be able to do this, because to do it in a conversation is one thing, to do it on this scale feels riskier, but I have so much respect for the integrity that you model in this work. And I also promised myself that for the people that I have hurt in these spaces, that I would carry the message forward, because it's the least I can do, to have people just, question themselves a little more deeply.
Beautiful. What a beautiful final word. Thank you so much for joining us. Psychedelic Therapy Frontiers is brought to you by Numinous, a mental wellness company committed to tackling the global mental health crisis by delivering best-in-class psychedelic-assisted therapies, contributing to the body of primary and clinical psychedelic research, and fostering healing through community connection and social responsibility. You can learn more about Numinous at numinous.com. That's Numinus.com. If you enjoyed the show today and you want to support us, here's how you do it. Rate and review the show on platforms like Apple Podcasts and Spotify. Subscribe to the Numinous YouTube channel, like the videos, and share it. Share the show or clips of the show with someone that you think will enjoy it. The content of this podcast does not constitute medical advice or mental health treatment. Consult with a medical or mental health professional if you believe you are in need of mental health treatment.